I'm Rosie.
Steve.
Emilia.
And I'm Charlene.
And we're going to talk about burns, how to treat a burn. Who wants to go first?
I think, do you think burns are quite common here, isn't it?
Very common. Yeah.
And something people really worry about, I think.
Yeah.
And Steve, I think you can say what are some of the causes of the burns?
Well, there's the main cause of burn, which people forget these days, is what we use most of, and that's electricity. Electrical burn it's dangerous in other ways as well, because it might affect your heart and other things in the body as well, but it is still a burn, and it needs to be treated as a burn. There's a couple of extra factors which I wasn't sure myself when I first taught this, but yeah, the initial burn is caused by the conduction of electricity where it touches you, and then it goes through the body, so that can cause additional issues going through your body, and then it will usually come out somewhere because electricity always tries to earth. So you need to look for a second site of burn, usually around the feet, the legs, bottom end of the body. Electrical burns are very, very painful and obviously cause a lot of trauma to the person, but the treatment for the electrical burn is much the same as ordinary burn. You must cool it as quickly as possible, and you must be aware the person is going to be in a lot of pain, and you probably will need medical help, especially for electrical burn.
I think electrical burns can be more difficult because you don't necessarily see it in the same way that you do with the other burns. So people, I don't know what you guys find, but when I'm training, I find that it's really interesting if you were to talk about, really high voltage electricity. What would you do in this scenario as a first aider? The amount of people that have said to me, well, I'd run to the casualty and, and check them and go through the Dr. A, B, C, but of course that's the last thing we're going to do. Right, so I think that electrical burns are really
important. Yes, the extra factor, as in all first aid situations, it's D for danger first. Danger yourself, casualty and bystanders. You always think of danger before you do anything with every situation, but especially electricity.
Yeah.
You've got to earth the electricity, you've got to turn the electricity off, or isolate electricity, or make sure the electricity isn't a threat to you.
And the high voltage thing is really interesting, isn't it? Because we think about turning off the electricity from the fuse box or whatever if you're dealing in an office environment or school environment or something like that. But if you're dealing with high voltage power cables, approaching is really dangerous because that can travel out really far. And I think it's where we get on the phone and we discuss our location or what 3 words. And then they can find out which power lines to be turning off.
But I also think I think heat is one of the things that we are most commonly because we are using our kettles
and
we are in the
it's
kitchen
hot.
and it's
hot,
hot,
right?
So we have sunburn, so we have something to do with the thermal, so thermal burns could be so there are various ways that are the causes of burns in our day-to-day lives. So I guess let's talk about how to treat them in general. So what's the first step you think, Emilia?
Well, so when you are dealing with burns, you need to make sure as a first aider that you are not going to induce infection. So although we're thinking about cooling, if you're touching that person in any way, you need to be wearing gloves, preferably, right? But equally, they need to be cooling the burn. So if you can get them to a tap, you don't have to be touching them everywhere to do that, right? But get them to a tap and make sure that they are running it under cool running water for 20 minutes or longer. So not freezing cold water, you're not going to maintain that, it's going to be really painful, potentially send someone hypothermic if it's long enough. So make sure you're cooling that burn. If you don't have tap water, there are some fantastic burns gels on the market now, and you can use those instead of, although it's preferable to run under the water first and then use the burns gel.
That's a really common thing, isn't it? That people think when you ask people how do we treat burns, they say, well, burns gel. But actually, we're only going to use those burns gels and things like that if we haven't got the water.
Yeah, exactly.
The water's the way forward. Really, really important, isn't it? To take that heat out of the burn.
I do a lot of outdoor delivery, and there's always a question about, well, hang on, I don't have any fresh running water, I've only got a river, or I've got this dirty water in a tippy tap.
Tippy tap.
We talked before about cling film for something, but if you have some cling film and you can cover your burn in cling film, you can use any old water to cool your burn. So I think cling film is one of those things that should be in any first aid kit because you can use it for a multitude of uses.
That's perfectly fine. I guess also one more thing I think to highlight is to remove any sort of
Yeah.
restrictive things around your body.
Yeah.
It could be the rings, your
Yeah.
watches, your bracelet, if it's possible.
You're likely to swell.
Yeah.
Yeah.
And also, if the burn is stick to your skin, ideally would not allow anyone to rip them off or take it because that's going
Yeah.
to cause more damage. So we leave it as it is on your body.
Yeah, and we've got our acronym, right, that we go through for our training, which is SCALD, SCALD, which helps us to remember the process for treating burns. So size of the burn is the first one. Yep.
1% of your body.
Not your hand, my hand.
Yeah.
Always casualty.
Yeah.
Yeah.
But that's a really key thing because I think people would struggle if you said 1% of your body. Just think palm. Yeah.
Yeah. So C?
Cause, which we already discussed. Yeah.
Yeah. Electricity and
Chemical burns need treatment because you don't know how they're going to affect the interior of the body or carry on burning the skin.
And then the A is the age.
Yeah.
Yeah.
Little ones and oldies.
Yeah, always.
Preferably. Yeah. And L.
Are we there? Sorry.
Yeah.
Location.
Location, yes,
So
sorry.
anything to the face, the hands, the feet, any burns encircling a limb, and I will say it, the genitals.
Yeah.
So those need medical attention.
Yeah, and that's kind of like straightforward, isn't it? If you're just thinking of the places where you
Yeah.
really don't want to
Yeah.
get burned, you really don't want to get burned.
Yeah.
Lots of sensitive places, and also things like the head, the mouth, the airway. So does it affect something else? You know, is it a burn in the mouth that's going to affect the airway? Then you've got other things to think about.
Yeah.
And the eyes, of course, anywhere around the face,
Yeah.
you know. Dodgy areas. It's kind of straightforward stuff, isn't it, when we're thinking about locations? Okay.
And lastly,
Lastly,
Depth.
depth.
Yeah. So anything that's full. So you've got the 3 layers. You've got the superficial burn, which will affect your dermis, which often red, painful, things like that. Those kind of burns. And then you've got if it affects the epidermis, so the partial thickness burns, that's going to be more blistery and fluid. Still painful, probably some redness. And then you've got the full thickness burns where you're going down to the fatty layer of skin, so it might be a bit more white, or you might have some charring around the edge of that one as well, but that white waxy layer. Actually, the pain for those might not be as bad as you think because you've burnt through the nerve endings. So just because somebody's not complaining of lots of pain doesn't mean it's not a serious burn.
And I think in the past, people used to refer to these as first, second, and third degree burns.
Yes.
And they're not really familiar with this terminology that we use now, which is superficial, partial thickness, and full thickness burns. So
I find it easier now, the training we have now, because I think I always get confused with, do you put first at the top of the worst, or is third the worst? So I always get confused with numbers. So I think it's good to have, whether it's superficial, you can hear that doesn't sound as bad as full thickness.
Yeah, I've always got stupid rhymes going on in my head. Best the worst, second the best,
Oh,
the one with a hairy chest,
Yeah.
but forget the stupid
Yeah,
rhymes.
I struggle with the numbers. Yeah.
so I think that's it, I guess, for our audience to
Yeah.
know, isn't
So
it?
size, cause, age, location, depth.
And that helps you work out when you need A&E attention. So anything more than 1% of your body seeking medical attention. If it's electrical or chemical,
Seek medical attention.
youngest and eldest err on the side of caution. Location we said, and depth. So all full thickness burns need attention. And I think depending on age,
Yeah.
the partial thickness depends on age.
But I would say if you're going to take anything away at all, put it under the water.
Cooling.
Get
Yeah.
it under
Cool
the
it.
water, cool it, minimum 20 minutes.
Yeah.
All good?
Brilliant.
Mm.
Yeah.